Hello, my curious cats, and welcome back to another episode of the Say Psychology podcast, the podcast for all the info on psychology's most questionable history. I'm your host, Leslie Lopez, PhD student and psychology nerd. Well, as you guys can tell, I have my original sound back. I'm back with my plain old white wall, which means I am now back from the motherland. And I know a few episodes ago I said I was feeling kind of homesick. I wish I could be back here, but now that I'm back, I kind of wish I was back there. You just kind of don't know what you have until it's gone kind of thing. And I was there for almost 3 months and it was the most amazing time. I was there for a lot of hard work, research wise and construction wise, but I did do a lot of traveling and exploring while I was down there. I think my top two most fun, best experiences while I was down there this past time, I think it was when I went down there to Las Cascadas de los Tercios in my dad's hometown of Suchitoto. The most beautiful view. I've never seen anything like it, honestly. The hike down was kind of scary as well as the hike up, but so worth it. And then also towards the end, my family, we took a small little road trip to Guatemala, from El Salvador to Guatemala. Amazing, 100% recommend it. I would go back to Antigua, Guatemala in a heartbeat. I've never experienced a culture as beautiful as that. It was amazing and definitely a time that I will always cherish and never forget. But we're home now, which means I'm back to my regular lifestyle. Morning gym, work, come home, eat, homework, schoolwork, research, and honestly, I'm a Taurus, so I live for that kind of stability. Nothing too crazy, nothing too wild. Every once in a while, we like to go out of our comfort zone, but mostly we're homebodies and we just like stability. We like knowing what's gonna happen next. Anybody else like that? Tauruses, I know we're all like that. But anyways, I think we should just jump into this week's episode, okay? This week we are diving into the history of electroconvulsive therapy, specifically the use of electroconvulsive therapy on children for research purposes. So, if you're a little bit insane in the membrane like me, get cozy tozy and let's jump into it. Alright, so let's start with what is electroconvulsive therapy. Electroconvulsive therapy, also known as ECT, also known as electroshock therapy, also known as EST, is a psychiatric treatment in which a generalized seizure is electrically induced to help manage certain mental disorders such as depression, severe psychosis, bipolar disorders, and schizophrenia, etc. The patient is brought into a room where they are given general anesthesia and a muscle relaxant. As those are kicking in, electrodes are attached to the patient's scalp. Then, their brain is stimulated with brief controlled series of electrical pulses. These electrical pulses target areas of the brain that hold significant control over certain mental disorders, such as the hippocampus, the amygdala, and the inferior temporal cortex. These electrical impulses cause a seizure within the brain that lasts for approximately 60 seconds. The whole procedure takes about an hour though, and afterwards, the patient wakes up in a recovery room where they're monitored by nurses for any side effects. Okay, because they just had electrical current going through their brain, so they need to be monitored pretty carefully. Often, the patient may feel a bit confused and drowsy right after the procedure. No surprise there. From my understanding, this procedure is usually performed 2 or 3 times a week for a total of 6 to 12 treatments. The exact number of treatments performed depends on the severity of the patient's symptoms and how they respond to the treatments. Now, I've mentioned this 1,000 times on this channel, okay? But I always like to reiterate, just in case. I don't want anyone coming for me for some misunderstanding, especially with medical facts, okay? I'm a PhD student, not an MD student, okay? Thank you. Okay, now that we know what electroshock therapy is, let's dive a little bit into the history of electroshock therapy. Just a heads up, the history of electroshock therapy doesn't have a clear timeline like a lot of our episodes in the past. It's a lot like a lot of it happened in the span of the same 20 some years. It's just all kind of all over the place, okay? As a Taurus, that's kind of annoying, but let's just deal with it, okay? All right, so the ECT dates back all the way back to the 1930s, when the concept of using one disease to treat another was thought of as revolutionary, okay? As mentioned earlier, ECT works to induce small seizures inside the brain to alleviate certain symptoms. The concept in itself is anything but brand new. The idea that inducing seizures to treat psychiatric conditions stems from as early as the 16th century, and we've mentioned this in like our last 2 episodes, okay? In 1785, the therapeutic use of seizure induction was officially documented in European medical journals. Before ECT, these seizures were done with the use of chemicals, usually one specific chemical called metrosol. By many reports, patients experienced a feeling of terror after taking metrosol just minutes before the seizure started. Now, this wasn't like psychedelic kind of scared, okay? It's not the good kind of scared. Medical reports tell us that this was actually an extremely horrible feeling. So much so that doctors and nurses had to literally chase patients around the room to get them to take the metrosol. Also, if you remember from our last episode, we learned about insulin coma therapy, where the occurrence of seizures was literally viewed as therapeutic. Given the wild experiences that occurred particularly with insulin coma therapy, doctors decided that there had to be a more humane and less fearsome method of inducing seizures. Which, that kind of sounds like an oxymoron, but what do I know? They still believed that the seizure itself was therapeutic. They just didn't like how complicated and messy the current methods were. Okay, so let's start our history lesson in the early 1930s. Let's introduce our first guest, Dr. Ladislas von Meduna. In the early 1930s, Dr. Ladislas von Meduna developed what we know today as convulsive therapy in Budapest, Hungary. Meduna hypothesized that there was an antagonism between epilepsy and schizophrenia. Therefore, inducing seizures could essentially cure schizophrenia. He strongly believed that there had to be a way to directly target and treat the brain of mental disorders that just boring old psychotherapy could not. Giant sigh. So in 1934, he officially introduced chemically induced convulsive therapy. In this procedure, he took a chemical called camphor, an epileptogenic agent, and used it with an IV to inject it into a mute catatonic patient of his. The camphor then induced a generalized tonic-clonic seizure. At first, after the seizure, there was no immediate side effect, but Meduna was dead set on his hypothesis that he induced 4 more seizures using the camphor. And after the 5th treatment, 5th time's a charm, the patient rapidly improved and was soon able to walk, speak, and even feed themselves. Apparently, the only side effect was that the patient could not recall most of the past 4 years of his psychiatric hospital stay. But if you think about it, like, is that really a bad thing? So, you win some, you lose some. Over time, this procedure rendered too messy, complicated, and dangerous. So it was quickly taken over by ECT. Let's please welcome to the stage our next guest, Dr. Loretta Bender, an American child neuropsychiatrist. Throughout her career, her main focus was in diagnosing mental disorders in children. Most of her research was with orphans, and in fact, Dr. Bender was one of the first researchers to ever suggest that mental disorders in children might have a neurological basis rather than attributing them to the child's bad behavior or poor upbringing. So, kind of like bringing in the genetics into the equation, where a child's mental disorder was more of a genetic thing and not just their upbringing, not just their home life. So in the peak of her career in the field of children with mental disorders was from the 1930s to the 1950s. There's that clunk that I was talking about earlier, just all in the same kind of time frame, the same years, like 1930s to the 1950s, okay? So during these 20 years, she worked at the Bellevue Psychiatric Hospital in New York, which is also where she was given the opportunity to actively conduct her research. And I will always snap and applaud a woman in male-dominated fields, which back then, a woman doctor, hello? In the beginning, Bender would diagnose many children with childhood schizophrenia and sought to treat these patients with this disorder. Now, what's funny, but also kind of not, is that today, these children that were diagnosed with early childhood schizophrenia would not be diagnosed with childhood schizophrenia, but rather development or behavioral disorders. Like, I'm just imagining a child with ADHD being diagnosed with schizophrenia and being treated as such. Like, bro, like I'm fine. I just can't concentrate, okay? But anyways, in an attempt to treat those patients diagnosed with childhood schizophrenia, Bender began to use ECT after finding that the practice was successful in other applications. These studies specifically were those of Dr. Medunas. See how we're going full circle there? Another study that she referenced in her research was that of French neurologists who used ECT on children in the 1940s and showed positive results. So Bender was, of course, thinking, if these guys can do it, so can I. And I'm going to cure childhood schizophrenia. So in 1947, Bender conducted her own ECT study on a total of 98 children diagnosed with childhood schizophrenia, all under the age of 12. In this experiment, the children were asked to draw portraits of themselves before the ECT, immediately after the ECT, and 15 minutes after the ECT. These children were exposed to ECT every day for a total of 20 days. In the end, it was observed that the children became more anxious with each treatment, and it was reflected not only in their behavior, but also the drawings that I just mentioned. It was noted that the children's drawings became more primitive after each ECT treatment. It's not funny, but like, you could imagine. With these results, Bender realized that maybe ECT was not as beneficial as she had imagined or hypothesized, if we're getting technical. Soon after its publication, she dropped the treatment, which all in good time, because it was around this time that psychotropic medications were making their way into the medical field. And like, I applaud her because she's a woman, even though her experiment didn't go quite as anyone would have hoped for. And actually, fun fact, did you guys know? Okay, so like, you know how today psychology is kind of viewed as a soft science, which pisses me off, of course. But did you know that in the early 1900s, it was actually viewed as a hard science? And the only reason it changed from being considered a hard science to a soft science is that women took over and men felt threatened. That's right. Men felt threatened that women were taking over this hard science field, and they were like, no, we can't have that. We can't have that. So we're just going to call it a soft science. Fucking eye roll, right? Moving on. There is a lot of evidence from the 1930s to the 1950s showing that ECT and the treatment of it were used in mental hospitals to control difficult patients and maintain order in psychiatric wards. Similar to our past topics, back then ECT was not intended to treat the patients, but rather make the lives of those taking care of the patients much easier. At the time, ECT was also used as a treatment for homosexuality. Of course it was. Are we surprised? Sadly, no. Also, not surprisingly, this was a major part of the ECT era and quite traumatizing to gay people who were forced to undergo the treatment. It's extremely scary to know that psychiatrists who used ECT specifically to treat homosexuality sincerely believed they were trying to help sick people, which honestly, if anything, it just serves as a warning against medicalizing behavior, you know? Like, on the bright side, if you could call it that, this form of ECT did not last, mostly because there was no evidence to suggest it altered anyone's sexuality in any way possible. Shocker. But by the 1960s, the evidence that ECT was effective in treating depression in adults was very strong, if we're being honest. We gotta give credit where credit is due. However, that doesn't mean there weren't valid reasons for patients to fear the use of ECT. Through the 1960s, many psychiatric treatments were beginning to raise eyebrows. There was a rise to revolt against medical authority by what is known as the anti-psychiatric movement. In short, the anti-psychiatric movement was a broad-based movement that questioned the legitimacy of standard psychiatric theory and practice. The movement specifically challenged the validity of psychiatric categories, diagnostic practices, and common forms of treatment. The movement's most significant concern was the medicalization. This is the process by which mental health issues are framed and treated primarily as medical conditions. In a way, many believe this movement was ahead of its time, given its question of authority over some very dangerous and skeptical forms of treatment. However, in its most extreme versions, the anti-psychiatric movement rejected the very idea of mental illness. Because, as mentioned, the movement rejected the idea of mental health issues being treated as an illness that requires medical attention. Those involved were high advocates for things like talk therapy, genetics, and life experiences. Like, think neo-Freudian meets psychiatry almost. Because of things like the anti-psychiatric movement, the use of ECT declined in the 1960s and 1970s. However, it did revive in the early 1980s. That was quick. Today, ECT continues to be used within specific cases. Not so much in children, because after some further research, it was found that ECT is actually not safe for developing brains. But it does render some benefits in certain adult cases. Increasingly, ECT came to be provided with consent, and the use of modified ECT became standard. Today, it's estimated that about 100,000 Americans receive ECT as a form of treatment for cases such as severe major depression or bipolar disorder, if and only if there have been no significant improvement through the use of other treatments. In fact, its most controversial effect is some memory loss. Well, my curious cats, thank you so much for tuning in to another episode. It was definitely a little bit all over the place today, kind of starting from the ground up, but I hope you learned something new and fun along the way. I know I did. Please remember to like, follow, and subscribe on YouTube, Spotify, and Apple Podcasts. Your support means the world. You have no idea. Also, please leave any comments or suggestions for future episodes because I want to know what y'all want to know. Oh, and please check out the podcast on Instagram for all episode news and updates at the Stay Psychology Podcast. As always, citations will be in the description if you want to check those out. Stay blessed, stay sane, and stay psyched. I love you. Bye.